Good afternoon, everyone. Thanks for joining us. Again, a lot of updated information to get to. We'll start by acknowledging that we know that accessing vaccines remains a challenge in the state of New York. I know that we've talked about this many times. The counties in the region continue to press the governor's office and the state to make and to provide not only greater flexibility to county health departments, but a larger portion of doses. Right now, the state receives about 300,000 doses a week from the federal government. We expect that number to increase. The Biden administration has announced that there should be a modest increase over the course of the next weeks. That increase to the states then would increase the allotment that would be distributed. But nevertheless, the doses come in through the federal government to the state. This state then decides where, when, and by whom those doses will be administered. And so we'll get to a few of the details about vaccines in Dutchess this week. But again, we just are not getting a large enough portion, the counties in the region, large enough portion to make the most effective effort that we think is necessary to provide access to vaccines and vaccination. But I will say that there is good news. The data is moving in the right direction, and I want to jump to the county's dashboard so you have a little bit of an update. And before we do, just to mention that we are joined today, also, as always, by our American Sign Language interpreters. We're very grateful. Last week, I learned that I know that I talk fast and a lot, and it was described to me that I'm sort of fast and a lot is fast, a lot. Thank you. This is my favorite. This is thank you very much. So we're happy to have you back with us. Thank you. I apologize. But we're also joined by Denise George. Denise is the president of Northern Dutchess Hospital, a special guest with us today. We'll talk to Denise in a moment about the impacts at Northern Dutchess, but in Dutchess County we have three terrific hospital institutions. Of course, Vassar Medical Center with that beautiful new pavilion, state-of-the-art. Westchester Medical Center, Mid-Hudson Regional, through the Westchester Medical Center network that is making a tremendous investment in pediatric and mental health care. We're grateful for that. And of course, Northern Dutchess Hospital, which is an amazing facility that still somehow, after all these years, Denise, still remains your sort of community hospital. State-of-the-art, great advancement, wonderful resource, but still feels like your neighborhood hospital. Denise, Dutchess County now is monitoring with all of you 73 hospitalizations, 73 individuals hospitalized. That is, just as a reflection, 2 weeks ago we were at 104 total hospitalizations. We were at a peak of 108 in the springtime. Denise, what could you tell us about the impact on Northern Dutchess as it relates to hospitalizations? Let's say, what do we see now? And why don't you give us a bit of a reflection on some of those more challenging days?
Sure. Hi, nice to be here. Thanks, Marcus. So currently we are less than 5 COVID-positive patients, but I will tell you a month ago we were in the 20s region. We had 20. So that was our high point, and that was really reflecting what happened after holiday celebrations with the COVID spread in the community.
So Denise, when somebody says, when somebody hears that you have 5 now and 20, what is that? What's the total? What's the total bed capacity at Northern Dutchess? And I've explained this a couple times to folks. Having an individual with an infectious disease of this nature, you only have so many rooms that are established for truly isolation. What does that look like? What's that breakdown at Northern Dutchess?
So we have 84 beds. We are small, but we can certainly accommodate whatever comes at our way. We had dedicated section of the hospital for COVID patients with dedicated staff. We didn't mix staff, so to keep our patients and our staff safe. So we can certainly handle it.
And we appreciate it. And the good news for you is not only the capacity of Northern Dutchess, but the relationship, of course, that exists within the Nuvance medical network, right? So you working with Vassar, working with the Putnam Hospital, and also the folks in Connecticut. there was a lot of, during the height of the pandemic with more hospitalizations, there was a lot of movement between those hospitals, and you were able to rely on each other for resources, right?
Absolutely, and it was quite interesting because Vassar sent us patients when they were full, and likewise when we either felt we were reaching our capacity or we had a patient that needed specialized care, such as dialysis, we would then transfer to Vassar. And in certain instances, we actually transferred to Danbury Hospital, depending. So we really tried to balance the load, so to speak, across our system.
Fair enough. And I want to thank you, and we'll get to a few questions for you as we get through the town hall. But I want to thank you not only for being here, you've been on all of our calls. So there's hospital calls with the state, there's hospital calls with the hospitals, there's hospital calls with the state and the hospitals, there's hospital calls with the county. We have probably been on calls nearly every day for 12 months. And so your participation, your involvement has been tremendously helpful, and we thank you for that.
Thank you.
So if you have a question, write it in the comment section below. So I do want to get very quickly, I know there's a handful of questions regarding what occurred, I guess, last night and into today with vaccines. So let's talk again a little bit about this. Dutchess County this week, the county health department received something in the neighborhood of 1,200 total doses. Now remember, the health department is one of the entities in Dutchess County. There's about a dozen that have the ability to administer vaccines. Dutchess County received 1,200 for the purposes of focusing on several populations. Number one and principal, based on the state order, are essential workers. And so we are required by the state of New York to prioritize essential workers. What has occurred these last several weeks, and this week, someone quite frankly, shared access to the scheduling link inappropriately. And this has been occurring in other parts of the state. It occurred, in fact, with some people in Ulster County earlier in this week. The essential workers in Dutchess County, we reach out as an entity to all of those essential worker employers. So for us, if that's, for now, it's school districts and school superintendents, it's fire districts, fire departments, law enforcement, those entities. We then provide them a certain number of slots that they organize within their organization. So the Arlington School District, through the superintendent's office, determines who within their employment qualifies, meets the standard for the state to get a vaccine, and then prioritizes them how they do it. So they might provide it randomly. They might prioritize based on certain concerns or needs. They fill those slots. What apparently occurred last night, and it happens because the state system stinks. I mean, there's no other way to describe it. The online database that we're to use to schedule your appointment can be hacked, it can be shared, and it can be accessed. And someone yesterday, among a very small number of essential worker employment groups, shared that link. And by sharing that link, opened it up to anybody who wanted to fill it in. And so what occurred, I guess, last night is some 400, give or take, about 500 total appointment slots were taken by individuals who were not for this particular clinic. This clinic is specific for the essential work staff that were identified by employers. This is the Phase 1B essential workers. Those employers had the responsibility to fill in those 500 slots. Well, somebody got hold of that link and shared it with the broader public, and people schedule them. We had to cancel those appointments. We have to cancel those appointments because we have to prioritize based on the state order, or we can lose our distribution, the essential workers. And the way we do that is by assigning, an equal number in these essential employer groups. They fill in the appointments themselves. They identify the 5, 6, 10, 15 people who are getting those appointments, and we cannot allow that to be used for general public consumption, even if you are an essential worker. So we apologize that you felt you were applying for an open clinic. We don't have the ability, the state system, for whatever reason, is able to be found, but Dutchess County did not share that link. Dutchess County did not authorize that link to be shared, and Dutchess County had already worked with the essential workers, the 1B category, the employers. And again, that's through a school district, it's through a fire department, it's through a police department to fill that in. Why? Because we have to prioritize getting through all of those people in order to open up to greater access. So if you're working for a school district and you've not been asked or notified by your district, then you and I, and I'm in the same boat, would have to apply through the general vaccine information subscription. And if you are qualified under the state rules, we can then let you know when your appointment's available. So that's what occurred last night. I apologize that people felt there's a bit of false hope. It was not anything county government did. We didn't share the link. We didn't want the link shared. And as I said, what also occurred for those of you who are online, and I understand, right? You got an appointment and it was canceled. It's unnerving, but equally unnerving is the fact that there were 500 people who were already told they were getting an appointment and they couldn't schedule them, and so those people had their opportunity taken from them, and they followed the process. And so I just would say to you, if you're watching and you receive that link, it's not the kind of thing that we can jeopardize, because the state is requiring county governments to focus our resources on a handful of populations. That 1B essential workforce we have to complete. We've got to get through police departments. We've got to get through fire districts. We have got to get through school districts, and this is the way that we're doing it, and all counties are doing it. And I know this because about a dozen school teachers reached out to me earlier in the week and said they got an email from Ulster County canceling their appointment because they weren't Ulster County teachers, and that's wrong. No, we're all following the same rules that the state applied. If you don't like those rules, I'll give you the governor's number. I'll tell you what where to call. But at the end of the day, there's an orderly process that we're using. It's just this state system, this database that they use for appointment scheduling. We can manage. In fact, we can schedule all 1,200 appointments. We can get that done every week. But generally what is occurring in certain places, and we saw it here last night, is the link is corrupted, and then individuals unknowingly, in some cases unknowingly, end up scheduling for an appointment that has already been pre-scheduled. And that is something we hope that the state can address, and we continue to address. But I'm asking you to be patient. I'm asking you to understand that if you want an appointment at a Dutchess County Health Department clinic, you will be notified of that appointment. You need to sign up in our vaccine information system. This vaccine information form, this is how we're doing it. You fill out this information. There's some questions that we'll ask you in order to track demographics and whether or not you fall within any one of these categories: comorbidities, senior citizen, essential work group. And when an appointment is available, we will tell you. We'll notify you. We'll plug in your information. And by the way, the same scenario, right? If you're sitting at home, we email you, tell you you got an appointment, and we're getting you scheduled, you wouldn't want that taken from you either. So it's just, sadly, this is the way the state has operated this system. It's not the way the counties asked for it to be run, but it is the way it is being run. It's just apparently last night somehow someone accessed that link and shared it broadly and quite frankly inappropriately, and we're sorry for that. But again, there were 500 people who had appointments scheduled that couldn't get them scheduled and thought that they were taken from them, and therefore we just have to live by this basic standard where the essential workers get selected by their employers, and we will open up and advise you when your appointment becomes available through the vaccine information system for those that qualify in the other categories. Let's finish going through the dashboard very quickly. 713 active cases. This is, we've been hovering below 1,000 active cases. Very promising, very positive news. 73 hospitalizations, as we've mentioned. And our positivity rate is now at 4.36%. Now, this is about half of what it was 2 weeks ago, and that's a significant improvement countywide. With that, as we said, active cases today 713. 2 weeks ago, nearly double at 1,301 active cases. During the springtime, we were at a peak of 1,860. And as we mentioned, hospitalizations down, significantly, almost in half from 2 weeks ago, in 108 peak in the springtime. Now, some of that we have to acknowledge is sad news as well, and that is that we have 397 of our neighbors who passed away and succumbed to the virus, and that, as you know, and we said in December, was likely our deadliest of months, and that's just a real heartbreaking bit of information. We are thankful that the severity of cases seems to be leveling off a bit, but those who still struggle in the hospitals, we have a great deal of concern for. Let's talk about some of the vaccine data that the states provided. I want to get through that. So as we said, Dutchess County represents 1.5% of the entire population of the state of New York. 1.5%. We have received to date 1.2% of the state's total doses. So the amount of doses we receive is reflective of the population. 8.31% of Dutchess County's population has received the first dose. That is a little bit below the current statewide average, although I will tell you the statewide average, I think earlier in the week, was 8.3% or 8.2%. So that average, that statewide average has obviously it changes. We're just below the statewide average in total percentage of population receiving their first doses. You can see Orange County at 6.6, Putnam at nearly 11%, Rockland at 10.6, Sullivan at 6.3, Ulster at 9.01, and Westchester at 11.5. You're going to see this number fluctuate each week based on the total numbers, but 8.3% of our population has received the first dose. That's 1 in 12 residents. So 1 in 12 residents of Dutchess County have received their first dose, which is promising news. And as I mentioned, that 10% of the entire statewide population on average has received first doses. The hospital workers, effective effort among the hospital community to vaccinate. Mid-Hudson Regional is at 79% vaccinated. The Dutchess County overall, 85%. Is that correct? 85% overall percent vaccinated. Why don't we jump to Denise George for a moment just to... Denise, I promised you I wouldn't talk about the science behind the vaccine, but what has been the response from Northern Dutchess Hospital employees and their comfort level, generally speaking, with being vaccinated, and what's been their experience? And have you been vaccinated?
Oh yes, I've been vaccinated.
You don't qualify because of your age. You qualify because of your essential work status.
Well, let's not talk about that. But our experience is about a little over 70% of our employees here are vaccinated. There are reasons why some people can't be vaccinated, and then there are still those that are vaccine hesitant. We would like that number to get higher, so we do continue to get very low doses now from the Department of Health. So, for instance, we have 100 doses coming in next week to continue to vaccinate the 1A, which are the healthcare workers. That's our focus right now.
Great, and we appreciate that, and I know that your staff has been through a lot. We had the good fortune earlier on to visit with a lot of the nursing and physician staff in the area hospitals during the height of the pandemic. How are your folks feeling? They have to have been. There's got to be obviously a degree of exhaustion, but almost a sign of relief, I assume, with the.
I would say so. The nurses working on the front lines and the physicians, I think they're weary. We're in this a year now, but they are optimistic, and I think one of the happiest places in the hospital is the vaccine clinic right now, where people feel a sense of relief. So we're optimistic we're also optimistic now that we're seeing the numbers decline of COVID in the community.
Well, I can appreciate that. I can tell you the happiest place in Dutchess County or any one of those clinics, and these days we go there just to know that there are people who are grateful and happy about about getting the vaccine. And I will tell you, the county pods have been running really very effectively. And if you have the benefit of getting to either one of the hospitals or one of the county points of distribution, they've just been running seamlessly. And we're grateful for that. Let's go back quickly to just running through. Let's run through some of the data points. I want to finish up on vaccination. So we're averaging at 85% of the hospital workforce has chosen to be vaccinated. Good news. At skilled nursing facilities, the county's average is 79% of residents at skilled nursing facilities, 48% of staff, which is a little low. But that's the current vaccination information on some of those populations. I will note we recognize the frustration that everyone has. We really do. This is not the system that counties planned for. It's not the system we trained for, and it's not the system that you, as taxpayers, through state mandates, paid for. This is the system that the state is using, and it's unnecessarily complicated. But let's also, and remember, there's a significant demand with a limited supply. Let's talk a little bit about the county pods this week. So this week, Dutchess County has 3 points of dispensing, and that's over the course of the next 7 days. We have 7 days to conduct our weekly vaccinations, meaning we get the doses in, and we have 7 days to administer those. I want to thank Dr. Neil Wythe and Kathy Tetmeyer, who's been administering and managing the pods themselves, along with Jim Soto and Joe Ryan, and our volunteers, amazing volunteers with the Medical Reserve Corps. So we are focused on 1A and 1B essential workers in this order. I'll get through those, give you some explanation. So our pods are functioning this week, 3 points. We are on Saturday open at Dover. Now the Dover is a new site. This is the new permanent location. This is the former CVS next to the current CVS on Route 22 in the town of Dover. So this will become the county's permanent Eastern Dutchess location. No longer are we at the Dover Middle School, High School. If you had an appointment that was supposed to be in Dover on Saturday, coming back for either your first or second dose, if you're coming to Dover on Saturday, you'll be going, and you should receive some confirmation, but you'll be going to the former CVS on Route 22 in the town of Dover. There will be signage at the Dover Middle School, High School alerting you, just in case you accidentally pay no attention to me and go there anyway. They'll redirect you to the former CVS. That's on Saturday. On Sunday, at the J.C. Penney, the former J.C. Penney on Route 9 at the Poughkeepsie Galleria, we'll be administering first and second doses. Now, if you were scheduled to get your second dose Thursday at J.C. Penney, that is now Sunday at J.C. Penney's. We're concerned about the weather. There's also been a slight delay in the distribution of vaccines because of weather conditions outside of our area. You're certainly familiar with that. So the decision was made, the Thursday point of distribution. If you have a scheduled appointment for Thursday, your appointment has been moved, and you should have either received an email and or a phone call. The staff's been making phone calls all day. If they don't get to you, if they didn't get to you yet, they're still calling. You may have seen a number you didn't know, didn't answer it, may have gone to voicemail. But if you had a scheduled appointment on Thursday, that appointment now is the same time on Sunday at the J.C. Penney on Route 9 at the Poughkeepsie Galleria. We are also having a third pod on Monday, also at the J.C. Penney's. And to confirm, there are no public links. If you see one or someone sends you one, there is not a public link to schedule your appointment. We schedule those appointments through the essential worker prioritization, working with those essential employers, and at the same time through a randomized selection in our vaccine information subscription for those populations that qualify. Okay. So that's a little bit of update there. As we said, Thursday's appointments are now on Sunday, and we'll continue to get you information and update that information for you. Let's do a couple. Oh, are people still going to be able to get their second doses in Dover on Saturday? Anyone scheduled on Saturday, still at Dover, just the new location at the former CVS. Wedding, this is my favorite. Denise, this is a great question. Wedding, you can't answer it, but I thought you'd appreciate it. Someone's asking about any update on wedding venues and if they can dance. Think about where we've come, that the governor of the state of New York is empowered to decide whether or not you dance at a wedding. This is what I'll say. We have not yet received any clarification on the wedding venue opening. However, the state of New York is saying that larger venues can open for weddings in March 15th, which is a very strange day to pick. Is that the Ides of March? That's a very questionable day to get married. No, it's fine. For all of you celebrating, happy anniversary. But the state is saying on March 15th that those venues can open. and there will be certain testing requirements. Those protocols have not been established, although I will tell you the counties in the region did make a request to the state that basically says the wedding venue or the wedding organizer confirms and affirms that the participants meet the testing requirements. We don't want to add extra burden to the venue or to individuals, but rather that they confirm it. Now, we're waiting for clarification from the state. That has not happened as of yet. But there were a couple... I'll get to that again. We'll still explain the appointment. So there were a couple of announcements the governor made today that I'd like to update for you. And beginning on March the 26th, indoor family entertainment centers can open at 25% capacity with temperature checks. So, what's a good example? I was gonna say like an arcade, but I mean I guess it's like an arcade, but an indoor entertainment venue can open March 26th, 25% capacity with temperature checks. On April 9th, outdoor amusement parks can open at 33% capacity. This is tremendously important. This is an entire segment of our economy that is very, very important to us. Places like Splashdown in Dutchess County, other amusement park facilities, other amusement and entertainment like venues open at 33% capacity. Tickets must be pre-sold, which is, again, understandable. We talked about this in the summer. There was no science that suggested places like Splashdown were a likely place of transmission of the virus. So coming into this summer, having them begin to open, very, very important, and we're very excited that those businesses will at least be able to begin the process of opening April 9th, 33% capacity. Overnight camps should plan on being open in June. So just as last year, there'll be some specific guidelines. The state has not issued them yet, but guidance is coming, and overnight camps will open in June. So some restoration of those important businesses and activities. Good question. Are child care providers being vaccinated now? Yes. First of all, anyone who qualifies as a New York citizen can try to schedule one of those at one of those state regional sites. Remember, if you go to dutchessny.gov, if you click on COVID vaccine update or COVID update and then go to vaccine information, you'll be able to pull up the information on our website, and it's on that page, that vaccine information page. Scroll down. As you do, you'll see a link to get to the state sites. Sadly, the state doesn't have a single point of appointment making, but you can go on our site and get to and see at least the availability at the state sites. The state site for the Mid-Hudson region is the County Center in Westchester County. And then we also, of course, can access any other state site, but that is the state location currently. Now, the governor said yesterday on a call with county leaders that he wants to expand capacity at local vaccine centers. We have asked. We'd like certainly the Poughkeepsie Journal building. We're willing to partner with the state. The governor said that that's something they want to do. They want to partner with local communities. So we are hopeful as the vaccine numbers go up and the dose allotment increases. We have asked that the JCPenney location in particular be expanded considerably. We can do probably 5,000 doses a week. We're doing 1,200 currently. So that's something that we're prepared to move forward with, and we're hopeful that the state would sign off on that. But if you go to our website and you scroll through there, you'll see the link to the state sites. You'll see the links to local pharmacies that we're aware of that have availability, and you can schedule there. Just as a reminder to those asking, Dutchess County does not schedule our clinic through an open link online. So the reason that is because, frankly, for those who don't have internet or computer access, it's a challenge. And it is then also this mad dash to try to access that link quicker than anyone else. And we're not doing it. In fact, most counties are not doing an open link of that nature. We are not either. If you fall within the essential worker category, the 1A, 1B category, you will work through your employer. Advise your employer. We're advising those employers, including daycare, as someone asked, child care providers. As we get more of doses, we advise those employers. They submit names and they schedule them. We are not in the business of trying to pick which school teacher or faculty member or police officer should get that. That's up to the employers to go through their list. We're very close to completing the law enforcement agencies that want vaccines. Police officers want vaccines. Very close to completing that. And as we get more allotment, we're expanding the capacity to get those 1A, 1B essential workers. If you want to qualify for an appointment, you can get on our wait list through the DutchessNY.gov vaccine information form. That's DutchessNY.gov/vaccine info form. Fill that information out, and we will advise you when the appointments are available. So it's not a mad dash. You're not clicking refresh on the website. There is not an open link. If there was, and there was one last night, it was because someone shared it, and by sharing it, stole the appointments of 500 people who had previously scheduled. And frankly, we just have to, for the essential worker class, have to go through that prioritized listing as ordered by the state of New York. Okay, so our healthcare community has been working tremendously hard. As we've said, great providers. We're hopeful that starting next week, organizations like Premier and Caremount Healthcare will have access to some doses. Don't flood them yet. Those offices will advise you when they have availability, but we're advised that within the next 7 to 14 days, we'll start seeing from the state doses to those organizations like those. So healthcare providers will have access. Now, Denise George is on the call with us today. Denise is the president of Northern Dutchess Hospital, my local hospital, as a resident of Northwest Dutchess. Denise, so let's remind folks, Northern Dutchess Hospital is conducting some vaccines for hospital workers, but you also have an antibody program that is assisting in treating and we hope minimizing severity of COVID. You want to talk about both those things? Who are you vaccinating? How's that going? And then what, if you would, explain the antibody program that's underway.
So the vaccination program is very interesting because we never really know how much vaccine we're going to get until a day before it arrives. And so our focus, as mandated by New York State, was to focus on healthcare workers, not just our own healthcare workers, but any healthcare worker in the county or really in the region, including outside, dentists, doing chiropractic offices, any of the staff there that are patient-facing. So that has been our priority. It continues to be our priority because, as I said, we're somewhere hovering in the 70% of getting employees done. Our next mandate is then to do the essential workers, just as the county, as you've been describing, Marcus. And then, there are, based on what is remaining, we can do then some of the over 65. And this week, we haven't really started too much of that, but this week available now are the patients that are compromised that are now on the eligibility list as well. But again, we don't get that much vaccine, so we burn through a lot of it with the healthcare workers and the essential workers. What I'm really excited about...
That's what I want you to talk about.
Yeah, the monoclonal antibodies. So that is it's an outpatient infusion that is offered to patients or to people that are COVID positive that have symptoms. There's certain criteria that they have to meet, but that they don't need hospitalization. And we do the infusion mainly to help to mitigate or prevent further deterioration of the individual with COVID, so that we want to prevent them from coming and needing a hospitalization. So we set up to do those in our emergency room because these patients are COVID positive, and we have the proper air exchanges and negative pressure and everything there. And so we've done probably about 150 community members who have come to us, and it's been great to get them to feel better sooner. So we're really excited about that. It's called monoclonal antibodies. You can just call the emergency room and talk to one of the nurses, and they'll get you set up. The sooner the better. We try to get people in within a day of them calling us, if not that same day.
Thank you for that. And we've talked about this at our town halls before. What we know about the virus is so much more today than certainly it was months and months ago. So our ability to at least minimize severity is getting better, and what you're doing at Northern Dutchess is part of that, and that's just tremendous. Let's talk a little bit about scheduling. I know we have a couple questions, so I'd like to go through those. How does the county coordinate with essential employers, and how does the randomizing work? First, we launched last week the new vaccine information form and a hotline. So if you dial 845-486-3555, this is for individuals who might not have internet or easy computer access. We're taking actually hundreds of calls from senior citizens at 845-486-3555. My office has been doing it as well. When you call that number, if you press 1 on your phone, you'll hear the update, this week's vaccine update. You'll get that information. If you then press 2, you'll be connected to an Office for the Aging staff or volunteer, and/or be asked to leave a voicemail. And we will take your information and input it in the vaccine information form. That will get you on the list on the wait list for scheduling. And again, if you're an essential worker, we work first with, and we've been trying to get through law enforcement, sort of the known entities, school districts, law enforcement agencies, fire departments, and then some other, the public transit workers, and that I think are the bigger groups. We work for school districts. We work directly through the school superintendent's office. They are responsible for inputting the names of the individuals that can be scheduled through their school district on any given week. Police agencies, we work that through the police chiefs or chief officers. They select and advise those individuals. And then the same is true with the fire departments. Their chief officer is responsible for identifying the names of the individuals who qualify for those. In the case of the broader essential workers, we try to notify through the Dutchess Putnam Westchester Child Care Council. We have some connection, and we advise as there's child care availability, vaccines for those who are doing child care, as there's availability, we notify them. And they share it with their members. They're mostly obviously independent businesses, so they have to, again, only a small allotment, but they make that determination. We also have an outreach to the retail industry, grocery store clerks, etc. It is not scientific. It is not universal. It's through the business community. We make contact through the different grocery store organizations, and we advise them of the availability, and they can then select those names for individuals. Now, anyone, no matter what your classification is, can sign up for the vaccine information form, and then through it's a Google-based or a Microsoft-based randomized selection within the database. So there's 32, 45, how many thousand names on the list at this point? Again, it is simply a computer-generated list that gets inputted on any given week. Now, this week we are doing pods for essential workers, right? So the only people being that have access on Saturday and Sunday of this week, except for those are going in for their second doses, are individuals who qualify as essential worker, correct? And then we are doing some additional and broader group on Monday of next week, correct? I get that right? On Monday of next week. So that is the system. It is basically, it's the best that we can come up with a lousy system because, again, more people than there are doses. The state system is not uniform, so you can't just call and schedule. And we're trying to make the best of it as we can. Now, again, as I mentioned, if you go to the county website, dutchessny.gov, you visit the COVID update and then the vaccine information tab, you can scroll down. There are approximately a half a dozen pharmacies throughout Dutchess County that do have vaccines. So again, the local health department, we received 1,200 doses. This is the largest allotment the county as a whole has received over these last 10 months. So we, in fact, saw a modest increase. And one of the questions that I'd like to get to was the governor said hospital doses were going to those with comorbidities. Has this happened? Only partly. I'll get to that in 1 second. But pharmacies are getting doses. As Denise said, the hospitals do have access for some of their employees. Federally qualified healthcare clinics and broader doctors' offices and the VA all have some doses. Just so you know, the ones that the state has advised us, Walgreens on South Road in Poughkeepsie was provided doses this week. Rite Aid, South Avenue in Poughkeepsie provided doses this week. Rite Aid Also, North Road and Poughkeepsie received 100 doses. Rite Aid on Main Street and Beacon received doses this week. We also were advised that CVS, among others, were receiving doses directly from the federal government, but that has not been, the total allotment has not been confirmed. But I happen to know CVS is vaccinating because I was at CVS the other day and they're vaccinating. So as those appointments become available, you can find links to them, and as we are made aware of them at dutchessny.gov, you can go to our website and then identify those other locations that may have access. So great point. Governor said, yes, at the press conferences, I'm sure. Great question. I know the governor says things. We don't always get the detail for several days or weeks thereafter. Yes, what the governor said is that the new allotment that hospitals would have been getting in any given week was now being redistributed for those with comorbidities. He did say that local health departments would get those doses. That is only partly true. What's occurred is that the doses that the hospitals were getting were reallocated for those with comorbidities. However, the state regional sites still get the bulk of the doses. So this week there may be as many as 10,000 doses directed to the county center in Westchester. That's 10,000 doses, and counties like ours, 1,200 doses. I think actually Putnam County received a reduction in the total doses they received this week from last week, and Ulster, I think, remained flat. Just as an example, we did see about a 500 dose increase, which is good news, but we believe the counties have asked that more of the regional site doses get to local health departments so that we can distribute them and healthcare providers so we can get them to patients who need them. So that is just an update on that. Does the county book pharmacy appointments? The answer is no. Dutchess County local health departments cannot schedule your appointments to a area pharmacy. You must go to those pharmacies, and to make it easier for you, you can visit dutchessny.gov and go to our vaccine information page. In doing so, scroll down, you'll see the links to the pharmacies we're aware of, the pharmacies we've been told have access, and you'll see their links there and their phone numbers there, and you can contact them. Same is true if you call if you're a senior citizen, you don't have access to the internet, you don't have the capacity to get through all those websites, call 486-3555, and someone will be able to help direct you to either getting your information, the information system, and or potentially those other locations that exist online. We can at least tell you who they are. So if I'm vaccinated, do I still have to quarantine? Great question. If I'm vaccinated, do I still have to quarantine? Here's the new CDC guidance, which the State Department of Health has accepted. The governor has announced this earlier in the week or late last week. So, if you're fully vaccinated and you're identified as a contact of an individual who tested positive, if you are fully vaccinated, that means you received dose 1 and dose 2. If you are vaccinated in 2 weeks past that, so 2 weeks beyond receiving both doses, and you are within 3 months of receiving that last dose and have no symptoms, you do not have to quarantine. So again, the state rule, which is the CDC rule, if you've been vaccinated after 2 weeks from your vaccination, the two doses, you do not need to quarantine if you're a contact with no symptoms and you are within 3 months of completing that vaccination. So why the 3 months? The science suggests that this is a long-term vaccine, but there isn't enough data to confirm and be certain. So as they monitor the data, they want to be sure that folks don't become that the vaccine doesn't, in essence, wear off, and you can contract the virus again. So they're saying if you're within that 3-month window, 2 weeks after you've gotten both doses, but within 3 months, and you're not symptomatic, you do not need to quarantine, and that is the New York State rule as well. I went through the governor's announcements today. We'd like to get to additional questions. If there are any, write them in the comment section below. Let's go back to Denise. Denise, folks always like to know what the basic visitation rules and what have you are at the hospital, and you're under the same kind of scrutiny. Obviously, you're a hospital and you don't want people getting sick. You also have rules that the state expects you to follow. What are the basics? So if I'm I'm not giving birth at Northern Dutchess, but somebody might give birth at Northern Dutchess. What's the basic expectation for families?
So basically, I'll talk about maternity in a minute, but we are not at this point allowing visitation in the hospital except for extenuating circumstances. We are working on opening backup visitation that will happen sometime in early March, but we're not there yet. In maternity, of course, the partner is welcome, is in attendance, and also they can have a doula if there is a doula present. The person has a doula. So that is maternity separate, though. Okay. But yeah, we're working on it. We are very concerned. One of the things that we want to do is get our vaccination clinics out of the hospital so that we don't have a lot of people coming in. Because remember, I said we are doing outside workers and essential workers as well. And as a hospital, of course, we are concerned about the variants as well, the variants that are out there somewhere we know, and the impact of that. So we will open up that visitation real soon. For our patients, it's been very, very hard. For our families, it's been extremely hard as well. So we look forward to having our visitors back.
And you mentioned the variants. Just for those who are watching today, while we have not seen a positive case of any one of the identified variants, there have been in the region. So we just advise folks that you have to assume that it is in the community. We do have a fairly low positivity rate. We are seeing a precipitous drop in the total positivity rate, which is good, but we still have to take those basic steps that we talked about. And Denise, you and I were on calls early on about wearing masks and social distancing. It seems that at this point, I think most people accept that these are still the basic steps that ought to be taken. Do you have any observation? I don't want to put you on the spot as far as science, but although you know the science, you're a registered nurse.
Right, I'm a registered nurse. So, we see the COVID rates dropping. We do know, I think it's really too soon to attribute it to vaccines because, as you said, only 8% of the county is vaccinated at this point. But it's really adherence to the social distancing, the masks, really less travel, and not getting together in large groups that has helped us get through this. So we're coming, we believe that we're tapering off in this surge and that, things are getting better. There are many in the field that think that we will have another surge yet again, but we don't know that. I think the seasons changing will help us again. Seems like coronavirus likes the cold more than the warmer weather. But then testing is still an issue, and we're probably still under testing. Yeah. We are seeing the demand for testing go down. It was very, very ferocious around the holiday when people were trying to travel or coming back from travel. We are seeing the demand for testing drop, which is concerning because, testing is really not being as promoted. It really is a good thing to do.
Agreed. And so what the state is saying, and we're working with them on this, is trying. I think the state is hopeful that they can establish sort of large-scale rapid testing sites with the expectation that if you're going, in theory, right, if you're going off to a wedding or you're going to an amusement, you could just walk in the day before or even the day of, get that rapid test, prove the negative, and then go off about your business. You could see that being beneficial, for instance, Dutchess Stadium, which we do expect to have baseball. The Major League Baseball is moving forward with the expectation that there will be some fans in the stands as early as May. And based on the governor's announcements today, it does look as if certainly outdoor venues like that will have the capacity, and some indoor venues will have capacity. So that's great news. But again, to your point, Denise, having access to testing is really important, and that should help us sort of return to at least something that resembles normal, and hopefully we continue to expand capacity there. But you're right, testing. I think one of the biggest challenges overall was distributing PPE, right? The distribution of that nationwide, and also the lack of a nationwide or national testing infrastructure. That was really problematic early on.
Right. We fumbled a lot in the spring, but we got through it. And, we've learned a lot. And we do know the masks work and social distancing. It does work. Yeah,
and I remember early on we talked a little bit about masks, and the concern, if you remember, in the beginning was that there wouldn't be enough. There wasn't enough product, and that they didn't necessarily want it being, in essence, redirected from medical professionals and healthcare providers and nurses and what have you. And when it seemed like they finally caught up with production and distribution, then of course there was a much more public push for public, for everyone wearing a mask, and we recognize that as well. But you and I were on many calls.
Yeah.
So we're asked about vaccine delivery, homebound seniors. Can vaccines be delivered to homebound seniors? The short answer is they will be when there are more doses. So what you should so let me offer to you what Dutchess County would be doing if doses increase. So if we're in a position where we receive a significant number of doses, and I was on a call yesterday with the governor, county leaders were. He offered that they would like to go bigger with some of the vaccine distribution points. We are offering up JCPenney's as a logical location. It is 2 floors. It is quite large. We have the parking. We have the traffic capacity. We have the staffing. We'd like to scale up there. If we had more doses, and when we do have more doses, what you can expect is similar to what we were able to accomplish for those with developmental disabilities. We had sort of pop-up clinics where we can get to a location. We can get to Rhinebeck, off-site at Northern Dutchess, perhaps in the village near a senior center, or we can be at Wappinger, town of Wappinger, and be in the senior center there, and create sort of a quick pop-up where maybe one day in any given week we could sort of focus our attention on individuals who don't have the same mobility, might be able to get to a more local place. Maybe we'd be at a regional site, a local site like Northeast in Millerton or Pauling. So again, that would be what we would do if we have the doses. And then additionally, if the doses get to doctors, in particular those larger healthcare clinics, they are prepared and able, in many cases, to get to their patients either directly at the doctor's office or at home. And home health aides and nurses would be able to deliver vaccines to the home. But that's when we have the capacity and the doses. We don't yet have the doses. Have more doses, Dutchess County is prepared to do those things. And you will start to see that some of the pop-up concept as we move into the next several weeks, where we can have a smaller clinic in a local location, focus on a population there, and then move on to another area. So that's an important advancement when we get the doses. We're prepared to do that. We just need the doses from the state of New York. And what we've said again is, instead of directing tens of thousands of doses to the state regional sites, just take a small percentage of those, 10, 15, 20%, and direct them to the local health departments with the understanding that we would have to get these vaccines closer to people. And so if you were trying to get a broader number and an equitable distribution, you would give us that capacity so we can get out into the community and administer vaccines. Also updated since last week, the state of New York is now saying restaurants can remain open to 11 p.m. The counties in the region and several others across the state asked for a midnight advancement. The state gave 11 p.m. And as we mentioned, large sports venues, that's with 10,000 people or greater, can function at 10%. But that is to be balanced against what was announced today, and that is indoor family entertainment centers, 25% capacity. And so recreation space, indoor recreation space, I assume that's like maybe like batting cages and arcade games, things of that nature. I'm getting old, Denise. I don't know what they are.
I don't think they call them arcades anymore.
Well, I know. Well, I'm a Dave & Buster's fan. I just don't know. Locally, you'd go to like Bounce or one of those kind of facilities. I'm sure somebody's online there saying what should be the answer. April the 9th, outdoor amusement parks like Splashdown can open at 33% capacity. And I promised Steve Turk and the Turk family, if he can get my friend Pat Ryan, the county executive from Ulster, to agree to it, we look forward to being among the very first to slide down a Splashdown slide. We want nothing more than these kind of venues to be able to open. Beaches, amusement parks, again at 33% capacity and pre-sold tickets. So to the Turk family and to our friends at Splashdown, I'll do it my own, but if you can get Pat Ryan to agree, we'll all get together and take an inaugural slide down at Splashdown at 33% capacity. And beginning in June, overnight summer camps should be open, So that is also good news for us. Let me mention, we do have some employment opportunities available. Most notably, we are looking for individuals who would like to be vaccinators, individuals who would like to administer vaccines. We have temporary positions open in county government. This is up to 30 hours of work a week. You can find it on our Facebook page. So if you scroll down to Monday, you'll see the employment opportunity post. Download that application, fill it out, and email it back to the Human Resources Department. We are looking for individuals who want to vaccinate. And these are paid positions, 30 hours a week of work, temporary, as we scale up our vaccine distribution points as well. A reminder, if you're looking to schedule an appointment through the county health department, you will go to dutchessny.gov, visit the dutchessny.gov/vaccine info form, click to sign up, fill that out, and you will be advised when an appointment becomes available. That's sort of our wait list. If you're a senior citizen and or anyone who, but if you're senior without internet access and computer challenges, we have our senior assistance phone line at 486-3555. 845-486-3555, dial 1, listen to the vaccine information hotline, and then 2, to be directed to an Office for the Aging staff or volunteer. Let me offer to you, before we close up, we recognize that this is really very frustrating. Believe me, we do. We get calls every day from angry and frustrated residents who would like this to work better. We would too. This is not the way we would have administered a vaccine distribution plan. It is the way the state is requiring us to do it. We cannot select who gets appointments. We don't get to select the sites where doses are administered. We don't, as county governments, don't determine how many doses we get, and all of that is increasingly frustrating. But doses are and the numbers coming into counties are growing slightly. As doses become more available, the appointments will become more available, and it won't feel like you're sort of alone in the dark. There will be that ability to schedule. So I know that you don't want to hear it from me, but we do have to be patient. We are trying our best to get through this as both the federal and state government increase and enhance their distribution program. We stand ready, as I said, county government working with healthcare partners to administer thousands upon thousands of doses a week. So we just ask you to please be patient and please understand that we don't want to have to cancel appointments. We don't want people taking appointments from other people. We would want the system to work better. It's just not our system, and so we're trying to make it work as best we can for you. And I promise. Every day we are advocating with our hospitals, with the state government, with the governor's office, with the federal government. Every single day we're advocating for more doses, more latitude, and more information so that we can get you the vaccine that you want. And if it is your choice to do so, we want you to have access. Let me mention that we're scheduled again on Wednesday, February the 24th. This will be our Facebook Live and telephone town hall. And that is 5:30 to 6:30 on Wednesday, February 24th. If you're interested in calling in, you can call in at 845-765-7121, 845-765-7121. Let's go back to Denise George. Denise is the president of Northern Dutchess Hospital. Denise, we're closing up. What should residents of Dutchess County know about the great work at Northern Dutchess? And any comments you wanted to make before we close up?
Sure. I mean, this is really we all feel this way at all the hospitals. If you don't feel well, please call your doctor. Please go for a visit. Go to the hospital. Don't be afraid, because we are still seeing that people are putting off really important health care and not coming into the emergency room or to get treatment when they should. And so when they do show up, they're very sick. So don't be afraid to come. The hospitals are safe. And we will take care of you. We're here for you.
Thank you, Denise. Let me say, and I know you and I have known each other for a very long time. Certainly since I graduated from high school and became a year later.
Oh, right now.
Well, you were 2 years ahead of me.
Right.
But almost 30 years. I will say that I'm very grateful. Dutchess County has a great relationship with all of our healthcare providers and certainly the hospitals in the hospital administration. You know this. I kid with you often, but I'm personally very grateful to you as a neighbor and as an administrator. It's wonderful, one, to see a woman rise to the level that you have. Administering one of these critical resources. It's always nice to see that we have a registered nurse administering one of these critical resources. And I think you know this from my perspective. We have been through in Northern Dutchess quite a bit. Potential risk of losing Northern Dutchess Hospital, the mergers, the ownership changes, and on any given day in our history, Northern Dutchess, really stood the risk of losing a local resource. And you, along with a lot of other names that came before you, and you know them, really worked so damn hard to make sure that Northern Dutchess as a community had that neighborhood hospital. And let me just say, as a dad, as a husband, and as a local elected official, we're grateful to you for that. So thanks very much.
And we plan on continuing that. So.
I have no doubt for years and years and years to come. It's a beautiful facility. The hospital's undergone so much work, and I'm grateful for it. And as you know, I have 4 children, 2 of whom are young. One is a 4-year-old, and one is a toddler, which means that between the 2 of them, there could be a Lego in their ear. There could be something that they put in their mouth, or any other things that would require us to rush into the hospital. And to know that you're always there is just it's really it's gratifying and it's comforting. So Denise, thanks for joining us today.
Thank you. Okay, thanks.
You're very welcome. Ladies and gentlemen, it's 4 o'clock, a little bit after 4. We're going to wrap up. We are back with you next Wednesday, as I said, 5:30 to 6:30, telephone town hall and Facebook Live. A nice thank you to our American Sign Language interpreters. They kept up with me today. It was exceptionally fast talking. How's it go? Fast? Like that?
Fast is in the talking.
Very nice. So I appreciate you keeping up with us, and we're thankful for them, and we're thankful to all of you for watching. If you have any questions, please do feel free to reach out. In the meantime, though, we'll see you next week. But be safe, stay strong, and be kind to each other.